All right, guys. This is Dr. Mahajan. I'm so excited. We got another edition of my Facebook Live today, and I got a very exciting guest for you guys. His name is Neville, and I'll have him introduce himself in a minute. Neville is a fantastic success story of doing well after going through COVID-19 and has to be on the vent for extended period of time and was in ICU for extended period of time and is back to work. So I'm so proud of Neville, and I was talking to him other day and I said, do you mind coming to our show and being an inspiration and a COVID warrior for our patients who are in similar age group, geriatric age group? And he smiled and he said, sure, I would love to. So I want to commend Neville to, come out and discuss about his ailment and be a role model for anyone, God forbid, who gets COVID-19 and gives a good encouragement that, yes, it will be rough. Yes, it's best not to contract it. But even if you contract it, that's not end of the story. So with that, we're going to get Neville on our show. We're going to also if you love our show, please do put your love, and I want to see your wows. And once Neville come, give him a lot of love. He went through quite a bit of hell and a lot of anxiety with his family. So give him a lot of wows, and I want everyone to guess his age. That's going to be our trivia today. I want to see if anyone can come close to what his age is, and I'll ask him if he feel comfortable to let us know what his age is. But without further ado, let's get Neville on our show today. Here is Neville. Hello, Neville. Can you hear me?
Hi there, Dr. Mahajan. Thank you very much for inviting me over. And,
all right, let's. I ask everyone to guess your age, if you don't mind. let me see. Anyone can come up with your right age.
Well, sure. I was born December 1st, 1938.
So that makes you 21?
Yeah, I don't know. You can do the math. I'll be 92 years old at the end of this year, December 1st.
92? You sure?
I'm sorry, is it 92 or 82?
82.
82, yeah.
All right.
I don't know. I might look 92.
Delinda said 80. So here is Delinda. She's saying 80. So she was pretty close. So we'll give her kudos to Delinda for guessing it. But you look not a year more than 21. Let me be honest, Neville.
I appreciate that, Doc. I feel that.
Good. All right. So let's start with, tell us a little bit more about, did you grow up here or you grew up somewhere else? Tell us a little bit more about your background.
Yeah, sure. I was born and grew up in the small island of Trinidad.
It's a beautiful island. It's a beautiful island.
Yes.
Yeah.
And educated in Trinidad and got married in 1962 to a lovely woman born in Puerto Rico. And after we got married, we both migrated to the island of Puerto Rico, and we went there as missionaries.
Oh, wow.
Yeah, spent approximately 17 years in Puerto Rico. I have 3 girls. They were all born in Puerto Rico.
Wow, so they speak Spanish?
Well, the oldest one, she is fluent in both English and Spanish. And the other 2 left Puerto Rico when they were pretty young. They understand it, much more than they speak the language.
I see. All right. So, how about you? Do you speak Spanish?
Yes, I speak it, understand it more than I do speak it, but I can get through the Spanish language.
Okay. Tell us more about your work life. Where do you work, and were you still working before you got sick?
Yeah, I was a bookkeeper in the island of Trinidad, and then when I migrated to Puerto Rico, I furthered my education in accounting, worked as an accountant and a traveling auditor in Puerto Rico
Wow.
for a long time. And then in 1977, I think it was, we went back to Trinidad, where I was born, and I was in charge of the education department on a full-time missionary. And sometime in 1982, I think, we migrated again to Florida, where I am living at the moment.
So, were you working in Florida?
I am working as the Chief Financial Officer at Christian Television Corporation, Channel 22.
Oh, Channel 22. Wow. So before you got sick, you were still working full time in Channel 22, correct?
Yeah, that's right. And even now, thanks to you, I started working again. This Monday past was my first day back at work after my illness.
Wow. So you're back working? My God, that's amazing. So,
Yeah.
I remember, we were chatting on telehealth visit once you got discharged from the hospital after your protracted ailment. And, even before you got discharged, your daughter called our office and she said that you want to talk to me about where you want to go from the hospital. And, and I was very honored that, you wanted, my opinion. So that's very kind of you. And then I was more impressed when you came to the office walking, and I was like, wow. And your daughter was with you, and you said, please release me to go back to work. And I said, what work? And you said, no, I'm good to work. And I was hoping your daughter says no. And she said, no, he's good to work.
When you told me it is not time for me to get back to work, I didn't know if you were joking or if you were serious.
Well, okay, go ahead, finish your thought. I'm sorry.
No, that's all right. I was really serious. I was feeling good as ever to get back to work. But when you told me, no, it's not time as yet, I don't know if you were joking or if you were serious. And then you looked at my daughter and said, is it okay for him to go back to work? And of course, she said yes.
So the reason I did that, as we get past 65, Neville, all our kids become our parents. You know that, right?
Oh, you better believe it.
So I wanted to get one of your parents' permission. It's like, when you're a kid, the kid wants to go to school, you look at the parents, say, hey, is he ready? So I wanted to check with the boss whether you're ready or not.
Yeah, I know, regardless of how old you are, you always have to get permission from somebody.
Right. So let's talk about, if you feel comfortable, let's talk about when did you first notice your symptoms and for COVID-19, and what symptoms do you remember? I know there'll be a lot of fog in your head with the protracted ICU stay and ventilator and all that. So tell me what you remember first. What comes to your mind in terms of the symptoms before you ended up in the hospital?
Doc, they said some of the symptoms, so like, difficult to breathe, you get out of breath for some time. And I told myself I don't have any one of those symptoms. So I felt pretty comfortable that I did not have the virus.
Hmm.
However, a very good friend of mine, who is an aide to a very, very famous doctor here, checked my temperature. And at that time, it was reading 103, 104.
Wow.
I had no other symptoms, but he asked me if he could take me to the emergency room. And I told him why. I had no symptoms of the virus, but he thought my temperature was a little high. So he insisted that I go to the emergency with him, which I did. But when I got to the hospital, all my vitals were normal. Even my temperature, apparently it went down from what it was to 96, 97, and they were about to send me home. But the gentleman who took me to the hospital insisted that they give me a further checking. And that was all that I knew, Doc. The next thing I knew, I woke up in the hospital room.
So,
Yes.
so you don't have any recollection after that day till you woke up after they took out the ventilator, correct?
Absolutely nothing, Doc. And
That's pretty.
I was told it was pretty bad,
Like,
close to death.
like. So let me, plug in some facts. Maybe your daughter plugged into that you are on the ventilator for about 2-3 weeks. Did they talk to you about that?
Yes, a long, long, long time, and I had no idea.
You had no idea.
Of course,
Okay.
yeah, I was heavily sedated.
Right.
Um,
And then,
uh, I'm
so
sorry.
no, what do you remember first after you woke up?
What I remembered is that I was lying in a hospital bed.
Wow. So let me talk a little bit about not just you, but what we see in COVID-19 patients who get sick quick. So that's pretty classic what you're describing, Neville. It's not unusual that we see patients who have just temperature for a few days. So probably you have the disease for at least 5-6 days before you ended up in the hospital, and that's pretty typical because you don't have full-fledged symptoms. You have mild symptoms, and you think it's maybe just flu or something. And then, by the time you get 102, 103 temperature, what we see in older patients, not you, you're younger, but, older patient is they crash very quick. Their oxygen drops very quick, and they end up on the ventilator. And then the week 2 of COVID-19, we see a lot of patients develop what we call cytokine storm, which is a technical word. What it means is the virus is pretty much done its damage. Now the body is overreacting. The immune system is trying to bring down the virus, and then it goes overboard. And that's when a lot of patients go into what we call adult respiratory distress syndrome. Not just COVID-19, with a lot of other viruses and bacteria also, we get this condition, which is serious. A lot of people don't make it with once they get to ARDS. So you're really remarkable that you could come out of it. So, I just gave a little bit education and background to a lot of our folks who are listening to your story. So tell me, then you woke up in the hospital, and what happened?
Well, as I told you, I found myself in a hospital room, and as you know, once you are told that you have the virus, you can't have any visitors come and see you, no members of the family. In other words, I was in total isolation.
How did you cope mentally? That must be very challenging for you, that, you went through seriously traumatic experience of serious health, and then you don't have family around. So how did you cope, Neville? Walk us through.
Yeah, Doc, I mean, that's a good question. I never experienced anything like that before. I know, as I told you, I had absolutely no symptoms, and contracting that virus was the furthest thing from my mind. My advice to anybody who is going to experience something like that: be positive. Don't give up too quickly. You are surrounded by good doctors, professionals who know what they're doing, including yourself, Dr. Mahajan.
Oh, you're so kind. Thank you.
Well, you are very instrumental in my recovery.
You're
When I
so
was
kind.
in the hospital, I was so heavily sedated. If I tell you the number of hallucinations that I had, it will take me 3-4 days.
You
But I
need to
was
write
so,
a book, Neville. You need to write a book.
I was given a new name, both by yourself and my heart specialist. You all now give me a name, a miracle patient,
You
and
are.
it was nothing short of a miracle. And I think not only my trust and confidence in God, which helped me tremendously,
Sure.
I took satisfaction that I was surrounded by good people who cared for me, who prayed for me, who did their very best medically. So be positive, don't give up, keep trusting in the Lord, and hopefully you will come through that experience.
Let me share something, and that may open up your eyes. I was surprised myself, Neville. I was looking through your discharge paper. You were admitted on April 17th, and you were discharged on 5/29. So that makes it about 6 weeks. So you're in the hospital for 6 weeks. That's really a miracle, out there, because not many people with advanced age with COVID-19 being on ventilator this long did so well and went back to full quality of life. Not just survived, but back to thriving. So some amazing force and prayers are pushing you, not just medicine.
Yeah, well, the 6 weeks that I was in the hospital, it certainly felt as 6 years. It's a pretty, as I said before, you have no visitors, not even members of your family. So here you are in this room, totally isolated. But again, as I told you before, the nurses, the doctors, the specialists made you feel comfortable. And I'm really thankful for that. And it's, of course, especially my faith in the Supreme Being. All of that helped me to where I am today. Back to work, feeling as strong as ever, a little weak. And you can tell by my voice, I still have some recovery to do.
Right. So let's talk about, what symptoms you have which you think are, different than before all this happened, which is still need recovery. So that will help our patient understand, God forbid they go through this, what are the long-term, symptoms they have to deal with. So if you don't mind sharing, please walk us through what you're still suffering from.
Well, Doc, as I said before, contracting that disease was the furthest thing from my mind. I had absolutely, as I mentioned before, no symptoms, none, except I had a pretty high temperature. And I think, that started the whole thing. And my advice to anybody, especially at my age and even younger, and especially if you have any underlying medical problems, don't wait, until you experience the symptoms. Get medical checkups as often as possible. Listen carefully to what the doctors would say, and don't take anything for granted. I had a very high temperature, not knowing that there were other symptoms that I didn't experience. So take the advice from your doctors very seriously. And if you do have any of those symptoms, especially, your temperature is way above, 100, seek medical help as soon as possible. Don't wait.
Right. That's